Pop quiz. What war was the first flying ambulance used in? Vietnam? Korea? World War II? World War I? How about the Napoleonic Wars? Okay, fine. Flying is perhaps not the best description of Baron Dominique Jean Larrey's horse-drawn ambulance, but getting wounded soldiers off the battlefield at 8 to 10 miles per hour was practically warp speed back then. In a fanciful World Journal of Surgery study of the Iliad, a survival rate breakdown of death by slingshot, spear, and sword in Homer's epic revealed an appalling lesson. If you wanted to survive ancient hand-to-hand combat, you basically needed to stay far away from ancient hand-to-hand combat. Up until the late 19th century, surgeons had very little idea what caused infection and disease. One theory was that gunpowder was poisonous, and so the prescribed treatment for gunshots was pouring molten hot oil into the open wound to disinfect it. So innovations in surgery came on the heels of changes in weaponry. For each newer and more deadly thing, surgeons scrambled to create a corresponding technique of wound treatment. From learning how to remove foreign bodies, rejoin severed tissues, and maintain blood levels through tourniquets, ligatures, and elevation, to whole or partial limb amputation and debridement. But for all their effort, the death rates from infection and disease far outstripped surgeons' increasing abilities to staunch blood flow and sew soldiers back together. 10 times more soldiers died of typhus, typhoid, cholera, and dysentery than war wounds in the Crimean War. 2/3 of the over 620,000 deaths of the American Civil War were due to disease and infection, and if you had your leg amputated above the knee, you basically had a 50-50 chance of survival. The real drop in death rates followed the introduction of Lister's antiseptic technique in 1867 and the acceptance of the germ theory of disease in 1882. With their newfound understanding of hygiene and germs, surgeons were able to focus on dealing with the never-before-seen level of casualties. The Vickers, the Browning, and the Maxim machine guns of World War I caused massive wounds and soft tissue damage, but surgeons were able to achieve the near elimination of amputations as a technique of avoiding infections, opting for innovative delayed wound closure and debridement techniques. The simultaneous development of motorized ambulance services decreased the amount of time it took to evacuate soldiers to fully equipped military hospitals, resulting in an overall mortality rate of 8.5% from all wounds in World War I, and a reversal of the traditional relation between death from disease and death from battle. Although Alexander Fleming discovered penicillin in 1928, it wasn't until the war effort's massive need ramped cheap industrial penicillin production to 21 billion units in 1943 and ultimately 6.8 trillion units in 1945.
They maintain a constant quest for effective countermeasures.
After the World Wars, the tactics of war changed. Generals were no longer lining up armies in open battlefields. Soldiers now had to navigate very difficult terrain, and physicians had to adapt their methods of getting around too. The Korean War saw the advent of mobile army surgical hospitals, which provided constant helicopter evacuation to fully equipped forward operating hospitals within 10 miles of the front line, ideally allowing treatment of soldiers within 3 hours of wounding anywhere on the Korean peninsula. In Vietnam, that time dropped to 1 hour, with a corresponding drop in abdominal wound mortality rates from 8.8% in Korea to 4.5% in Vietnam. Today's military continues to perfect the system. In the Iraq and Afghanistan wars, asymmetrical war tactics have relied heavily on suicide bombing and improvised explosive devices, which cause massive tissue damage and blood loss. Exsanguination is the #1 cause of death in modern conflicts. In response, each soldier is equipped with a tourniquet in addition to their body armor. Blood-clotting wound dressings and needles that go directly into the bone, which are much easier to keep securely in place in moving vehicles like Army Humvees and helicopters, have been widely adopted, as has been massive blood transfusions, all of which have led to reductions in death due to blood loss. Today, civilian and military medical systems fly patients out of disaster zones or rural areas to major metropolitan trauma centers. In 1792, we had the flying ambulance. In 2015, we have the flying ICU. While we continue to grapple with wars that never seem to end, there's one thing we can be sure of. Civilian emergency medical services, as they are today, would not be nearly as effective without their wartime counterparts. We must remember how many have gone before us, in pain and suffering, to early deaths in far-flung places, and how doctors, nurses, and medics repeatedly put themselves in harm's way trying to figure out how to bring them home.